The White House displaying this stunning slide, showing even if current social distancing guidelines are maintained, the White House projects 100,000 to 240,000 deaths in the U.S. over the next several months.
The scenario is between 1.6 million and 2.2 million deaths. That's the projection if you do nothing. So we've never really done all of these things that we're doing. We've put them into a model. We've looked at the Italy data with their self-isolation, and that's where we come up with, if we do things together well, almost perfectly, we could get in the range. Scenario would be 100% of Americans doing precisely what is required. But we're not sure, based on the data that you're sharing from around the world and seeing these pictures, that all of America is responding in a uniform way to protect one another. So we also have to factor that in. Cities that don't social distances, that don't stay at home, that believe you can have social interactions, that believe you can have gatherings of homes of 20 and 10 people even, that is going to spread the virus even if everyone looks well.
As sobering a number as that is, we should be prepared for it.
So, of course, this is a projection, and it's a projection based on using very much what's happened in Italy and then looking at all the models. And so, as you saw on that slide, that was our real number, that 100,000 to 200,000. And we think that that is the range. We really believe and hope every day that we can do a lot better than that, because that's not assuming 100% of every American does everything that they're supposed to be doing. But I think that's possible.
Over the next 2 weeks, you said that the next 2 weeks are going to be very painful. Is the bulk of this going to happen over the next 2 weeks?
You have an upslope. So as mortality, the fatalities to this disease will increase, and then it will come back down, and it will come back down slower than the rate at which it went up. And so that is really the issue, how much we can push the mortality down.
Yeah. So our hope is to get that down as far as we possibly can. The modeling that Dr. Birx showed predicts that number that you saw. We don't accept that number, that's what's going to be. We're going to be doing everything we can to get it even significantly below that. So, I don't want it to be a mixed message. This is the thing that we need to anticipate, but that doesn't mean that that's what we're going to accept. We want to do much, much better than that. So what we're going to see, and that's we got to brace ourselves, in the next several days to a week or so, we're going to continue to see things go up. We cannot be discouraged by that because the mitigation is actually working and will work. The slide that Dr. Birx showed, where you saw New York and New Jersey, and then the cluster of other areas, our goal, which I believe we can accomplish, is to get the hotspot places, the New Yorks, the New Jersey, and help them to get around that curve. But as importantly, to prevent those clusters of areas that have not yet gone to that spike, to prevent them from getting that. Now, the 15 days that we had of mitigation clearly have had an effect, although it's tough to quantitate it because of those two opposing forces. But the reason why we feel so strongly about the necessity of the additional 30 days is that now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope and I know that we can do over the next 30 days. And as I said the other day and on one of the interviews, we are a very strong and resilient nation. If you look at our history, we've been through some terrible ordeals. This is tough. People are suffering, people are dying. It's inconvenient from a societal standpoint, from an economic standpoint to go through this. But this is going to be the answer to our problems. So let's all pull together.
Young people, they seem to be more affected, or at least that's what the media is telling us here in the United States. Is that true? And if so, why here more than in China?
That's a good question. Everybody knows that the original China data made it look like young people virtually never got involved in a serious way. Then as we start getting into Italy, looking a little bit more like us, France, European countries, and ourselves, we're starting to see individuals in their 30s and 40s. Now, if you look at them, still, many of them have underlying conditions, even though they're 30 or 40. They have diabetes, they have hypertension, they have things like that. But if you look closely, you will see that there are young people who are otherwise well, who can get seriously ill. So we need to forget this, that if you're young, you're good to go, you have no problem. There are two issues with younger people you need to consider. A, you need to avoid infection, just like everybody else, not only for your own health, but even if you get trivially involved, you can be a vector that would ultimately infect someone who does have a real risk of serious conditions. It's kind of like the young, healthy 25-year-old gets infected, goes home, infects grandma and grandpa, or a 40-year-old uncle who has metastatic disease on chemotherapy. That's the problem.